Hello everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be starting with the central nervous system, and it is a very important topic and a very important section. Just like CPS, you have CNS, and they both are asked as a long question. Okay, so in this video I will be discussing about the introduction. What are the points that you need to understand in your CNS? So CNS is basically composed of two things. You have your brain and you have your spinal cord, because the rest are the peripheral nervous system. Just your brain and spinal cord is your central nervous system. Why central nervous system? Because it lies in the center. That's why. And periphery, why? Because they lie on the periphery. Next, they are basically responsible for the coordination. Your brain is responsible for the coordination. Just like your mother is responsible for coordinating the whole house, your brain. So your mother is your brain. Okay, so don't eat her brain. Okay. What higher function it has? It has the higher function of thoughts, the memory, right? Just like some memories are very difficult to forget. Then you have all the emotions, the language that are regulated by your central nervous system. Now, gross division, what you have? In the gross division, you have the forebrain, the 𝗲𝗵𝗵𝗴𝗵𝗺, 𝗵𝗵𝗵𝗵𝗺, midbrain, and the hindbrain. Mainly three. What three? Forebrain, midbrain, hindbrain. And then you have the division in the forebrain. You have the 𝗲𝗵𝗵𝗴𝗵𝗺. In the 𝗲𝗵𝗵𝗴𝗵𝗺, you have the frontal, parietal, occipital, temporal, and basal ganglia. These lobes, I will show you the figure. Then you have the 𝗲𝗵𝗵𝗵𝗺. In the 𝗲𝗵𝗵𝗵𝗺, you have the thalamus, hypothalamus, and the subthalamus. In the midbrain, you are having the tectum, tegmentum, and the cerebral peduncles, right? Next that you have is the midbrain. In the midbrain, what are the things you are having? In the midbrain, you are having the tectum, tegmentum, and the cerebral peduncles. Okay. In the hindbrain, what you are having? Hindbrain is also called as the rhombencephalon. See this figure. You are having the forebrain, hindbrain, and midbrain. Okay. In the forebrain, you are having this is your mainly the forebrain. Then you have the hindbrain. Then you have the midbrain that basically regulates your movement, right? Then you have certain cerebral lobes and their function. Let's just see them also. First you have is the frontal lobe. They are for the motor and the planning. Broca's area are there that are responsible for your speech, okay? And if this Broca's area are impaired, then you have the broken speech. So remember, Broca means broken. Broca means broken speech. Then you are having the parietal lobe. There you have the sensory integration. Then you have the temporal lobe for the hearing. Temporal for the hearing, right? Here you have the Wernicke's area, Broca's area and Wernicke's area. We will read about these areas separately also. They are the heroes, right? So see this, you are having the frontal lobe. Here you are having the temporal lobe, parietal lobe, occipital lobe, cerebellum. Frontal lobe, temporal lobe, then cerebellum, occipital lobe, and parietal lobe. Let's see cerebellum. Cerebellum is for the coordination, movement, and balance. See, cerebellum, B means balance. It is responsible for the balance, right? So this is where the cerebellum is located. Then you have the brainstem. In the brainstem, you are having the medulla, pons, and midbrain. Midbrain, pons, medulla. You are having MTM. Okay. Then you are having a limbic system. In the limbic system, you are having what? In the limbic system, you are having the hippocampus. Then you are having the gyrus and the septal nuclei. And in the basal ganglia, you are having the caudate, putamen, lobus pallidus, subthalamic nucleus. They are responsible for the motor control. And guys, please, one more thing I want you all to do is while reading this CNS portion now, just make sure you are thorough with your anatomy also. If you are not thorough, you won't be getting that much retention in your brain, and I won't be able to explain you each and everything from your anatomy as well, right? All the relevant points, although I'm discussing over here, but it's just a request, just what's your anatomy lecture once. Okay, so then you are having the vascular disorders. In the vascular disorders, you are having the aneurysm, like the perianeurysm. I have told you perianeurysm is seen in the subarachnoid hemorrhage, and in subarachnoid hemorrhage, the patient complains that there is a history of severe headache. The patient complains that, doctor, I'm having the worst headache of my life, right? And this is basically a diagram which we will see. I have just kept this diagram over here just for your review. Then you are having the neurodegenerative disorders. We will read each and every disorder in detail. Okay, so you are having the Alzheimer's disease, you are having the Parkinson's disease, that are in the dopaminergic neurons that are present in the substantia nigra. Huntington disease, CAG, hunting in a cage, that we have read the mnemonic, right? I hope you remember. Clinical correlations: if there is hemiplegia, then there is defect in the corticospinal tract. If there is ataxia, there is cerebellar lesion. If there is aphasia, there is cortical lesion like in the Broca's or the Wernicke's area. If there is memory loss, there is lesion in the hippocampal region. If there is Parkinsonism, there is lesion in the basal ganglia. And if there is locked-in syndrome, there is lesion in the central pons. Lesion is there. So this is about the basic. And please watch your anatomy CNS portion very well, so you will be very crystal clear, right? And you won't be needing to revise it multiple times, right? Because it is a very important chapter, very important segment. CVS and CNS, they both are super important in each and every subject. Okay, so I hope I made myself very clear. If you are having any sort of doubt, please don't hesitate. Please feel free to DM me and I will answer all your queries. Thank you so much.